I'm sorry, but I can't help but add, what set of circumstances exists that lawyers from the state are feeling the need, based on whomever they're contracting with, to incorporate into their proposed agreements protection against human trafficking? That the persons that they're contracting with, they want to protect, make sure that they're not engaged in human trafficking.
Especially when it's a unit of local government. That's pretty hard.
I mean, that's one silly example, but it's in there.
Any more discussion on G5?
Sorry, before we go on, I want to apologize. When Aaron asked the G5 was being pulled out, I confused that with G6, and I wanted G6 pulled off. I thought he was pulling it off as a discussion.
We can do that.
But then we take up both sections or separate items.
We can do that. Okay, any more, is there a motion on G5?
Yes. I'll second.
Second. Any more discussion? Seeing none, all in favor, say aye.
Aye.
Opposed, say no. Passes, G6.
And G6 is the one that dealt with, I thought we were dealing with the lease of with the environmental alternatives for the juvenile hall building. And I had been opposed to the use of that in that fashion, and would just like to be able to vote no on that particular lease. And I'm not going to go back and recount the last 10 years of hate and discontent I've had about this. Jennifer, I know is doing a good job and is trying to make it a better thing, but I just feel it's not appropriate for us to be using a public facility for that purpose when we have public needs that could benefit from the use of that space.
Jen Browning, Chief Probation Officer. I would just like to say that over the course of a year, we have increased the lease for the group home. So we doubled the rent, and we did add payment of 25% of the utilities, which so far has brought us in about $36,000 in revenues. And the year hasn't ended yet, so we still have May and June as well to charge for. So my only thought is at least right now it's bringing in some money until we can figure out what else there is to be done there.
Good job. So who else uses utilities at this address?
Our juvenile detention facility staff and then the inmates.
Any more questions on G6? We have a motion to pass it.
I'll make that motion.
Second. Give me a second here.
I'll second.
Gotta wait for a second. Okay, we got a motion and a second. Any more discussion? Seeing none, all in favor say aye.
Aye.
Opposed say no.
I'll say no.
We have 1 no and 4 ayes. Thank you. Okay, that will move us on to G6.
G8.
G8 or G8.
Yes, I asked for this to be pulled, Mr. Chairman. You know, in Iridium, we're talking about a contract to the bank, and in there we're talking about fees and different levels. And I didn't see anything in here with fees, you know, like, what are the fees? I mean, I don't want to sign just a blank deal. And is this standard protocol? Or, because, I mean, I know that some of these things change, and this is kind of for a long-term deal, but, I mean, it'd be kind of nice to have a breakdown, so I kind of know what I'm saying.
I can provide that to you. However, it is in a binder because we have a lot of fees because we deal with a lot of entities. So I don't think we've ever really attached the fees to the contract when we had it approved because we have different levels because we deal with the schools and the college and the special districts and then the county itself. So I'm more than willing to provide that to you. I can email it to you at any point in time you would like. But it is a huge file.
I could address that too. The contract that we've had U.S. Bank for as long as I can remember. From during the term of the contract, there will be new services that become available that weren't available today, and there will be a fee associated with that. And they may propose changes to fees, or in a lot of cases, they reduce them. And so, to safeguard against excessive fees, there's an option out of the contract that the treasurer has authority to do within, I think, 30 days, 30 or 60 days. So there's a safeguard there, even though we've got a multi-year contract. If there's some problem with the fees, we've always got a way out. And for that reason, that provides a lot of comfort for changes that they may propose as far as fees go.
Well, it does, but if I'll put my name on something, I'd like to see what it is. my personal opinion.
We can bring those back, the current ones.
If everybody else is happy with the way it is, that's fine.
And I can send that to you, Aaron.
Thank you.
Well, the question kind of comes down, it's nice to know, and I think I appreciate knowing what the fees would be, but if we don't accept the fees, then we don't get the service, so then we need to look at what the alternatives are, and are the fees this bank charging competitive with the fees being charged by other banks, and the ease and conveniences that would be there, so it all kind of has to be
And we
weighed
did
out.
go out to RFP, and they were the most competitive, and basically, they are the only bank in our region that can allow us depository services as far as, you know, being able to scan checks. I mean, we could go out to like a Bank of the West, but they don't have a location here, so where do we go to deposit our money? So we did do an RFP, and they were the most competitive bank for what the county needs in our area.
So Plumas Bank and Tri-Counties are not equal?
They are not. They don't provide like the, we scan in all of our checks directly to the bank. We don't actually take our checks to the bank any longer, and they don't have the platforms. RFPs were sent out to them, and they did not respond.
Bank of America does?
Bank of America did not respond to RFP. They're kind of getting out of government
They
banking.
have check scanning.
They do have that, but they did not respond. So the ones that responded were like, well, in this RFP, only U.S. Bank responded, because last time Bank of the West and I think Union Bank responded, and we weren't comfortable using a third-party depository to take our cash to and have them wire it to our bank. So we're kind of limited in the banking and the banks that we have in our area that actually meet our needs for government banking.
Okay, any more questions? Good, we have a motion to approve.
I move.
Second?
I'll second.
Motion and second, any more discussion? Seeing none, all in favor, say aye.
Aye.
Opposed, say no.
No.
Ayes have it.
I-
Approved. Yep, 1 no and 4 ayes.
I think Bank and Beaver should take care of it.
Do you want me to send, Aaron, do you want me to send you?
Please, I would appreciate that. Thank you.
Uh-huh.
Okay, I think we had 10.
Yeah.
That was full lawsuit.
Yeah, I told that, I don't know, I'm not familiar with this advisory board, Richard, is this something that's been in place for a while? Just an informational question.
It's just a, yeah.
I will be attending. Here,
Yeah, this just came to us, and I'm not familiar with it either, but
yeah,
I've seen.
Have you
these-
seen this
I've
before?
seen these notices for the last several years they come through. I just kind of assumed that you already knew and was attending, so,
this is the first one I've seen,
oh, okay.
yeah.
Yeah, this is, they, actually, I think we, as board members, received it in the mail directly, so this is a copy that's in our, but it comes to,
it goes to the chairman.
Well, the one that I was kind of concerned about was 4 in the military munitions response site status, and I was just kind of wondering what that was.
We'll find out on the 28th.
I know.
Tom, on number 2 there, the update on the ERV, or what
Yes.
that is?
Yeah. I assumed, I know, believe it or not, they're injecting molasses into the groundwater underneath the Army depot to get rid of that.
Just looking it up.
Yeah, and I guess it's very effective. That's the truth. I thought they were pulling my leg when they were telling me that, but they are actually injecting molasses into the groundwater.
it slows down the migration of the plume too. It kind of,
Does it?
in
Yeah.
terms of it just kind of seeping. That was something that in Southern California, the Barstow slug, that's how they were able to kind of help.
It's something
slow
about
it down.
the bacteria eats up the contamination.
Okay, I think we need a motion to approve 10. Get the fees and receiving correspondence, but we should do a motion for that.
I'll move.
Second.
Second.
Motion to receive the file. Any discussion? All in favor, say aye.
Aye.
Opposed? Ayes have it. Okay, that'll take it to 8-1.
That's gone.
That's nothing there. H2.
Morning, Mr. Chairman, board members.
Morning, Doc.
H2 is a proposal to revise our Mental Health Services Act Innovation Plan that you approved back in February. We had initially written it for a 2-year plan. When it got to the Mental Health Services Oversight and Accountability Commission, they were so excited about it, they asked us to extend it to 4 years. And they didn't offer any more money, but they asked us to extend it. But the chances are good that if we're successful, we will get some more money for this one. So innovation plans are intended to be a form of field research to explore new ideas and solutions and then report back to the state on what did and did not happen or what worked. They require extensive data monitoring and reporting. Our innovation plan calls for the use of technology to help us stay connected with and monitor the health of our most at-risk patients who are diagnosed with serious and or chronic mental illness. The plan calls for us to place fully integrated computer with a touch screen, and no mouse or keyboard. You've seen those with just the screen. In the home of the patient. Connect that to the internet, and then to subscribe to an internet-based service system that facilitates a holistic health approach to recovery. This is a really cool system. It's called Grand Care, and I saw the demonstration up at Northeastern probably more than a year ago. And so with assistance from doctors and therapists, the vendor will customize whatever services we need to meet the needs of that individual patient in their home. With this system, we can substitute we can institute a daily check-in via Skype, so we can have, they'll be sitting at home and ding, and our nurse will come on and say, "Good morning, Joe. How are you this morning? How are you feeling? Did you take your medications? Did you go for a walk yesterday? How's your diet going?" These kinds of things. We can program daily medication reminders, and not only that, don't forget to take your medicine, but here's what it looks like so that they take the right pill. And we can ask them to confirm that they did take the pill. Of course, they can still lie and press the button that they did, but most people just need a reminder. The system can be programmed to help them maintain connections with family and friends via email or Skype. Because we all know that if you are depressed, staying connected with family and friends is a great way to help fight off depression. And so some of them are isolated, their kids have moved away, family members live far away, not everyone lives in the immediate vicinity of their families anymore like they used to. And so with regular Skype sessions, if you set it up for like a Sunday afternoon at 2 o'clock, they just go to either the family can call in and it'll come up and they can talk to them, or they can press the button and call the family member, or we can set it up any way they need to be set up. It's a very, very cool system. We can also set up a series of videos on a variety of topics that will help them, about their illness, about eating healthy, about the benefits of exercise. All those kinds of things can be set up on there. If they have programs that they like to stay in touch with, and maybe they can't get good TV reception, there's a wonderful example that the vendor gave. They placed them in homes of people who are early Alzheimer's patients before they get to the point where they need to be in care. And this one woman was in her 80s, and she didn't want any blankety-blank computer in her house. She didn't have the use for it. So they talked to her, and she'd been losing her sight through macular degeneration. She really missed reading the Bible. And then because of a change in the local radio station, she could no longer get Bill O'Reilly. So they set her up. The only way she would agree to having them, giving them the ability to also call her every day and see how she was doing, was if they also gave her recorded Bible, readings of the Bible, and the access to the Bill O'Reilly show. She was good to go. So it's just a fantastic system, all kinds of things you can do. It can also help monitor blood pressure, glucose levels, pulse rate, blood oxygen levels, any piece of medical equipment that can be that can give a level or a rate that can be Wi-Fi enabled, and that's blood pressure cuff, pulse oximeter, all those things. We can set those up so that if there's a certain level we're watching for, it can alert our nurse when it reaches that level, or it can alert a family member, or it can go straight to 911. I mean, you can set all kinds of tolerance levels and alerts in there. Very cool way to help stay on top of people's illnesses, because a lot of our chronically and seriously mentally ill folks also have other illnesses. They have diabetes or heart problems or blood pressure. So taking care of the whole person gets to be really important. we believe this kind of health surveillance and improved response times will help people maintain and improve their overall health, and that's going to be the purpose of our innovation plan, is to test that theory, whether it really works or whether it's just pie in the sky. And then we think that will prevent or reduce hospitalizations, and we're really excited to move this plan forward. So if you approve it, from there it will go on to the Mental Health Services Oversight and Accountability Commission, and once they approve it, we'll be free to get started on the program. Any questions?
I have one question, Mr. Chairman, and a little bit distressed by it. And having been involved with the behavioral health program and attended a number of these meetings, I'm looking at page 1 of Exhibit B in particular, and it deals with the demographics. And it once again points out the problem we've had, I guess, in getting staff to appreciate the significance of how our census population is represented through the census and the impacts that the prisons have on that. It correctly reports what our population is, the 2010 census of being 34,895. So a person who reads this document is looking at us providing service to 34,895. I call it the Blockbuster effect. When Blockbuster located here, they looked at the census data and they were convinced they had enough people to rent their videos, and so they opened up business, built a nice little building, and did what normal businesses would do. And was a little bit shocked when they opened their doors and the lines weren't going out the doors like they expected, only to find out that roughly 25%, if not a third of the prospective customers they would have were locked up at the prison and generally don't have visitation rights to a video store. So, I mean, it's a huge disconnect that's there. And during the proceedings, we discussions at the behavioral health meetings and looking at the previews of these, I've asked that be updated and correctly quantified. And what came back, and I appreciate what she did in terms of getting the population figures per the 3 prisons, because that was missing in the earlier draft. So we've now quantified 4,500 inmates at High Desert, 5,700 inmates with the California Correctional Center, but that includes the camp population that's recorded here, but there's some of them were scattered around Northern California, so they're not all located here. And the Hurlon Federal Prison has a population of 14,884.
1,400.
Yeah, when you add all that up, that's 11,684 inmates. Now, I think a fair amount of those are underreported in what the overall census is. So that census of 34,895 probably only reflects about 8,000 or 9,000 inmates, and that would have been at the time in 2010. This is 2015. The populations fluctuate, but the reality, and what in here it says, it should be noted the U.S. Census data incorporates data from the 3 prison systems, which skews Lassen County data, i.e. population, ethnicity, and gender as it relates to the general population services. So it defines what the problem is, but it doesn't give you the solution. And what I think is missing, and what makes, I think, this effective, is that when you back out the prison population, because they're getting their services under this kind of a program through the prisons. They aren't coming into the general population service sector, so whatever behavioral health services they need, they're going to be addressed, through CDCR, through the federal prison system. And we all know that CDCR is having their healthcare system, which includes behavioral health, being monitored or managed by the federal court. So that's a whole other world unto itself. They probably have far greater service being provided than what we get in the general population, and that's all being paid for by the state of California. But what it does, it leaves, if you use the math that's here, 23,211 people who are actually the ones that we're providing services for under this document. That's what this is.
Actually, we're only proposing to serve 100 people.
100 people. Well, that's 100 people out of the 23,211 that would be potentially targeted. And I would say we have more like 27,000 people, because just in the city of Susanville, that sign says 17,500. And that respects about 9,000 citizens and about 8,500 inmates. Well, we already know that they're showing 10,400 inmates as being the amount that's being recorded, at least with these population numbers. But I think it's important that this particular page be kind of reworked to reflect, the fact that we've got, a base population, that civilian population is being served, which is a lot different than what's being represented by the using the bare bones census data, and out of that, we're only going to be reaching out to about 100 people to put it into perspective, because I think this falls short of doing that. So if there's a way to revise this to include that, I would be very happy. I'm full in support of the rest of the document. I've been really appreciative of the work of behavioral health staff and the behavioral health board that have put this together. But I brought it up before, and last fall I brought it up in January, and bring it up along the way, and here we are. We're still, I think, falling short on that. And it points out another issue, and I think maybe with Mr. Shaw now on the staff in Mr. Egan's office, I think we need to take the census information and come up with a boilerplate description of what Lassen County's situation is using that census data, and have that adopted by the board, have it developed by administration, and then promulgate it to all the county departments, and if possible even to the nonprofits and others that are submitting grants, so that everybody can use the same language instead of having these grant writers struggling, trying to figure out how to do it, and not having guidance, because it's a defect in every one of our grants that we send out. I mean, we're competing with other communities, and it gives a false representation. And I'm sure that we probably have gotten some funding because people think we got 35,000 people here, and not thinking, the fact that 10,000 of them or more are locked up in federal or state institutions, and it's huge. And I think it's something that needs to be done. Well, yeah, I mean, we can say, yeah, give us the money, and we can just, we can chuckle all the way to the bank, but that's not honest. And I think that, the bottom line is we have a target population. If we're going to serve it, we need to define who they are and not commingle them and create that kind of confusion. And it has been a problem that has been around for at least 20 years.
Okay.
We've struggled with it.
Any more questions from the public? Ellen?
Well, I didn't get the big packet, but no impact, 100 touch screens. So that has to cost something. And what about the employees to do all of that? Are they going to reduce the employees? You got easier stuff, so...
There's no impact to county general fund. It's all covered under the Mental Health Services Act funding that was specific to innovations projects. So it comes to the Behavioral Health Department under MHSA funding, and it can't be spent on anything but innovations projects.
Which
Like
comes
this
from
one.
the state.
Well, once they still keep collecting their money, you still owe them.
Yeah, that's all.
You're still paying for it. Everybody
Oh,
pays for it.
yeah.
Well, actually, the millionaires paid for this one.
Yeah,
I guess that could be you.
I have a public comment, and I haven't done my research on what you're talking about.
You take your name for this.
Teresa Anderosi, I am a resident of Milford. I also am representative of California Home Care Workers that represent IHS workers. And in our technology age, this is just disheartening to me because to me it's taking jobs away, and a lot of the services that is offered there is a home care worker services, is a nurse's services, and it's an interaction with the public that I have family members who suffer from mental illness, so I know a lot about mental illness, and a lot of them don't like technology, they don't like telephones, so it's an invasion of their privacy. But to me, it's also, looks like they're not getting the interaction they need from a human being to remind them of their medications, to take their blood pressure, and that's things that keep them in the home and out of nursing homes. But I just really wish you would, I'm as a public person, I think this is horrible that we're spending dollars to put technology in people's homes that the human being has always done for years. That's my public comment.
Thank you for your comment. Anybody else? Larry, do you have it? You get it. I think I seen your hand up once, I'm not sure.
Yeah, I was Paul Scotty. I was just thinking to myself, are these going to be connected to the internet?
Yes.
All right. Do we have a plan in place if these people that use them wander off into the wrong websites, download viruses, etc.?
You can limit them to whatever services are appropriate, so that they wouldn't be able to access anything else.
Any more questions? Again, one more.
Just one question. I think Paul triggered on something that triggered in my mind. Are these units going to be able to be hacked by the South Korea, the North Korea?
Well, I can't guarantee anything, but it's, you know, it's the same risk we take with all of our computer systems.
That was an insight.
I have
That was a concern.
Some of these people probably don't have internet. Then what?
It works on cell phone. We see, they actually were doing it by cell phone from Northeastern, and it worked fine.
Okay.
So, and you know, there are places where people can't get cell phone either,
Right.
so we know that. And for those, they just won't be able to be in this project, and we'll have continued services the way we are now.
Okay, any more questions?
And we're not proposing that this replace services. We're proposing that daily interaction might really help people.
Gene Hodge.
Is that a GoPro there on your desk?
Yes. Cute.
Yeah, it's very nice.
Is that for here for the with board, or is that you got an internet website?
No, I don't have a website. It's mine.
Would it be wrong to say that you let people know that you're doing it?
Back to the topic.
What's there? You can see it. I put it up.
You didn't make an announcement of it.
So do I have to make an announcement?
Well, it would be courteous, I think.
You did mention something earlier about being honest, so yeah, maybe.
What are we talking about? I think we're on an agenda.
I know. They're wondering. Go ahead.
Well,
The
you
camera,
don't know,
he's got
the
a-
chairman. All I ask, or what Gene is asking, I don't mind if anybody videotapes and put my picture on the internet. I just didn't know what it was, and I was wondering what the blinking was, and I just thought maybe that we're out here being honest about what we're doing. He could be honest about what he's doing.
Okay, we just stick to our agenda.
It's a public meeting. You can. I've got, Mr. Chairman, I have this, and I have it sitting right here.
I put it on top so everybody can see it.
Well, it's a better angle there. I tried all over and it didn't. That's the best spot for it.
Okay, if your questions on this agenda item, fine. I'm not there
Okay,
anymore.
I didn't mean it.
I
We're
will
going
get
to be
brought up later, that's all I was going to say.
Mel, did you have any,
No, anyone have any more questions?
anybody have any questions?
I didn't have any more questions. I just think it's a great project, and we're looking for the minimal people, like Melody said, it's going to be for a select few. They're going to need this as a, for lack of a better term, it's very innovative project. It's kind of an experiment. Yet, they're not giving up on the services. It's a way to try to help people. I think it's a great show.
I think it's to add to the services.
And just for people's information, this system is available to the general public. If you want to know more about it, you can give me a call. I'll be happy to tell you about it. So, for instance, if you have family members who are elderly and in need of some regular contact, maybe just to keep in touch with them, you can buy this for them. It's about $700 for the computer and around $45 a month for the service, and then whatever internet costs you.
Okay, thank you. We have a chair with entertained motions.
I would make the motion to, what is it, H2? Let me find it under H2.
Yes.
Right here, adopt and revise, to adopt and revise the, adopt and revise 2015 MHSA Innovation Plan, and approve each addition to mental health services oversight of the county government commission.
And I would second that, Mr. Chairman, with the proviso that we further try to clarify and fix the demographic section on page 1 of Exhibit B.
Okay, we have a motion and a second. Is there any more discussion before we vote? Seeing none, all in favor say aye.
Aye.
Opposed say no. Ayes have it. Thank you, Mel.
Thank you.
We'll take a 5-minute recess.